question to know whether he has information as the chair of the relevant committee what killed our students.
Honorable Chair, why I like
you have your liberty.
Why I like you, Honorable Chair, is because you're the most engaging chair we have in this assembly, and we appreciate. Honorable Chair, once again, I also want to rise on the issue of public health concern in our schools, an issue that has caught us by surprise. And I'm not sure whether it's so much surprise, because this has been a problem that has been building up, and it has always been a bomb in waiting. And when we find ourselves now in this situation, I think as a country we really have ourselves to blame. Honorable Speaker, the bacteria that has been found to be affecting our young people has been identified by the medics as Escherichia coli. Sometimes it's called E. coli. And of course, the other one that has been identified to be affecting our children by the medics is the Salmonella typhi. And these bacteria are bacteria that the doctors will tell you they are mainly infections which are based on hygiene. I had a discussion earlier on with the honorable member here about the typhoid and cholera outbreaks. These are diseases that are generally and are known to be third world diseases and infections. They are infections that are affecting our children because of hygienic conditions that they are living in schools. Honorable Speaker, as we are saying this, I want to call your attention to the many policies that we have had in this country that deal with the issue of public health in our schools. We have had the National Schools Health Policy that was developed in the Ministry of Public Health and Ministry of Education before. We have had a Kenya Comprehensive School Health Policy that has also been developed. Honorable Speaker, as recent as 2018, we had another school health policy that was also developed by the Ministry of Health and the Ministry of Education. And all these policies that we have developed have generally not been implemented in our schools. And for that reason, we find ourselves in a situation where our students are suffering because of errors of commission and omission by our administrators and even by ourselves. Honorable Speaker, we might speak about deaths in schools as if it's something which is far-fetched or which is very far from us. Honorable Speaker, without giving much details, I know that we have also had members of parliament in this house in the recent times admitted in hospital with cholera infections. That is a fact, and that has happened recently. Honorable Speaker, we are talking about the students, but even in this house we are affected. Why are we affected? Issues of sanitation. Sometimes we may blame the problems of congestion in our schools, infrastructure in our schools, but some of these issues are coming because of not following laid down procedures and codes of operations, especially when it comes to the issue of health. And that has been a big problem. Honorable Speaker, we have the school health inspectorates that is supposed to be conducted by the Ministry of Health, and this has also now been domiciled in our county government. Are they doing their work? Honorable Speaker, the answer is no. We no longer have these inspections. We no longer have the impromptu inspections in our schools, and this department is like it has died a natural death. And even when we have these inspections, what happens? The inspectors who go to the schools have their hands greased to look the other way, even when they find that issues of sanitation, issues of hygiene are not carefully taken care of. Honorable Speaker, it is high time as an assembly we took action. We ensured that there is implementation, enforcement of these rules, enforcement of our health and
you will be given 30 seconds.
Honorable Speaker, thank you very much for graciously giving me 30 seconds. And I want to urge this National Assembly to, through the Ministry or through our committee, the Health Committee and the Education Committee, to do a proper investigation of this case, and a proper investigation of the policies have already been developed in this country. Because we don't need to develop new policies, because we already have policies. We have laws, we have the Act. Honorable Speaker, let us have a report in this House, which is going to be done by the Committee of Education and Committee of Health, the Health Committee, giving proper a report on what is being done and what should be done in our schools, so that we can avert these deaths. Honorable Speaker, our children are dying, not only from hygienic problems, from accidents, from mental health issues. A lot of suicides now happening in schools, and a lot of from corporal punishment in schools. Honorable Speaker, we can't watch our children die in schools as we sit in this honorable House without taking action. I thank you, Mr. Speaker.
Honorable Fatuma Jeo.
Thank you, Mr. Speaker, for giving